Welcome to Chew's Health HQ. I'm Jack Chew and this is a day in my clinical life, showing you how I integrate KINVENT tools to help me deliver the best quality MSK care I can. You may know me from my work founding Physio Matters, but it's all well and good talking a good game on the internet, but we built a bespoke clinic that puts all that theory into practice. Everything is geared towards maximising the experience for both patients and clinicians. We have rooms for assessment, the gym for treatment, and a full set of KINVENT devices that enhance both.
Hi, is it Rob?
Yes.
Hi, Rob. Nice to meet you. Nice to meet you, mate.
I particularly like the challenge of being an MSK generalist and assessing and treating a variety of MSK issues, whatever it is that comes through the door, such as Rob here with low back pain. As part of my assessment, I'm using a squat rack and KINVENT's K-Delta force plates to test Rob's mid-thigh pull, interested in how much force he can produce.
Right, 3, 2, 1, and pull. Let's go, let's go, let's go. Right, good. Now do that again, but try. Okay.
I particularly like the versatility of the KINVENT kit, especially the amount of tests we can do, different body parts, different types of examination. But especially being able to make that consistent between the clinicians is really useful, and having a cluster of tests that we're knowing that we're going to be using for different, say, pathologies of body parts is really helpful. Obviously, upfront investment is paid back very quickly once you start realising the compliance and the way in which people will then start to really thoroughly extend their rehab and care. And then you can move people into sort of conditioning type appointments, memberships in which they then start to aspire to improved functional rehab and get into them to be the best they can be. So I think it's got that clinical utility as well as then as a business owner, it feels like an increasing no-brainer. Without it, I'm not sure how we would be able to really accurately measure in such a way that motivates compliance.
My next patient, Felicity, had a myriad of lower limb issues. It gave me the chance to test an entirely different set of diagnostic skills. Assessing her limb symmetry mattered more here, and so it was useful to have the tools at my disposal.
Having several devices is useful as well, where clinicians can pick it up and put it down. It all feeds into the same app, and it means that that central data also feeds into the practice management software. It totally seamlessly integrates into Clinical, which is great because it's immediately on their records, and also for our clinical lead to be able to check in on how it's being used by our clinicians more thoroughly.
Here I'm setting up a KINVENT K-Pull device, giving me a really accurate force comparison for each limb, how much force you can generate through a knee extension.
I'm really interested in how much force you can generate through this knee, and that's the best way to think about it, and we'll test it against the other one at the moment, and we'll reevaluate at the end. This is going to show us as we go, you're going to press for 3 seconds, rest for 5 seconds, and do 3 lots of that, okay? Yep. You'll be able to see your own results, you're just trying to get as high as you can on the number across 3 reps, okay? So, we'll go right side first. Just grab hold of the back of the bed so that then as you push against it, your bottom doesn't lift. We just want to try and focus as much as we can on how much force you can produce through there. You just practice it best of 3. Okay? Okay. I like the way that all the devices will sync to a central app that then also coordinates with clinical or practice management software. Especially with several clinicians that can then just pick up the devices and use them in whatever room they're in. We leave the force plates in the gym. And it also means that then testing various different body parts in different patients across various different parts of their aches and pains and ailments over years even, means that it all coordinates centrally and we keep track of that. Think about the utility of getting a baseline screen on validated measures at the start of a season. That might be an otherwise uninjured player or athlete that then is getting useful information that you can then test against if they do injure themselves to make sure that they at least return to that baseline in season. And so that can be really helpful if you're trying to engage that patient and consider prehab, consider prevention, and then rehabilitating them thoroughly into then conditioning. As with any equipment or technology, it's an investment front end. However, the way in which it returns investment is really clear, is that it really motivates patients to return, to want to test themselves against their other side, or to make sure that they return to their baseline. Also, when it comes to those final appointments, someone might be 80% there, the symptoms are reduced, it's not as intrusive on their life. But if we realise on certain conditions that actually making sure they don't become complacent at that 80%, seeing that all the way through to 100% is something that's just not how it looks or how it feels, it's also how it tests to make sure that we get someone there and they're staying as better as they can be.
Between patients, I have a bit of time to catch up on some admin. I don't like writing notes, but one thing that definitely helps is that KINVENT app loads directly all of our patients into our clinical notes and vice versa, so it's really straightforward. The final patient of the day is Jimbo with his weak shoulder.
Okay, Jimbo, come on, have a lie down on your back for me. No, onto your back. Good. Okay.
Of course, I can manually muscle test, and I still do that for a variety of reasons to try and just get a sense and feel with my hands, but it doesn't compare to the accuracy of the dynamometers. Let's get an accurate sense of how much force he can produce.
So this is going to measure the force that you can produce through this pad. I'm just interested in trying to work out where the movements that you've got at the moment are painful on my tests. I'm just interested in how much force you can generate compared to the other side. So again, just take the strain, go and push, and then we'll win. So measuring carefully means it takes the guesswork out. Sometimes motivation is hard to come by for some patients, and therefore actually then when symptoms are being vague and the response rate is challenging, they're not necessarily functioning as they want to be, then sometimes then being able to measure themselves against it week to week or month to month and really working towards, say, normalising, say, an asymmetry or aspiring to be able to produce force at a level that is functionally safe for their injury, it means it really helps compliance, and their trusted provider having technology that can help them do that means that they are and do come in more often, and then we'll see their rehab all the way through to completion. Okay, well done. Good luck with your exercises. Hope it goes well. Have a nice holiday.
Well done. Yeah, cheers.
Have an evening.
Thank you very much.
All the best.
All that's left is for me to finish up that pesky admin, close the clinic up, ready for another day tomorrow.